Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute, Hyderabad. Today we are going to discuss about what are the reasons for low testosterone in men. Because this is a common issue nowadays. Most of the people with low libido, sexual dysfunction, premature ejaculation, lethargy, weakness, obesity, all these are directly or indirectly related to testosterone. So now, why this testosterone goes down in males? What are the common reasons? And in next video, I'll tell you how to improve testosterone naturally. So now coming to low testosterone, you have to understand where the testosterone is produced. In a male, the main hormonal axis starts in the brain and it ends in the testis. We call it as HPT axis, hypothalamo-pituitary-testicular axis. Some of the hormones are released in the brain and which in turn help in production of testosterone in the testis. So now, what are the hormones which are released in the brain? One is FSH, second one is LH and prolactin. So normally prolactin controls these two hormones. If prolactin is too high, then these hormones are suppressed, both FSH, LH. And if prolactin is low, then these hormones will be in the normal range. So now what happens with the FSH and LH, and these hormones are continuously released from the brain in a pulsatile manner. Pulsatile means every 2 hours, 3 hours, these hormones will get released into the brain. That is the reason when every time you check these hormones, some variations may be there because of it's every 2, you don't know exactly these hormones are released into the blood stream. So now, what is the role of FSH? What is the role of LH? So FSH will help in sperm production, LH will help in testosterone production. And where these two things has to work, it's in the testis. Testis is the factory for production of testosterone and production of sperm. So now, when there is low testosterone, then all these hormones has to be considered. So now, since the factory is testis, anything wrong with the testicular function can lead to low testosterone production. So what are these issues? Like lack of exercise, too much of heat, lack of proper sleep. So now, but you have to divide them into two groups. One is a central group and second one is a local group. Central group, that means which acts on the testis. See, suppose if your sleep is not good, then obviously LH production will be on the lower side. So if LH production is on the lower side, then it leads to low testosterone. And lack of exercise, again LH will be low. Obesity, there estrogen will be on the higher side. See, estrogen is a female hormone and testosterone is a male hormone. So now in obese people or people with excessive fat, this fat, what it does is it absorbs testosterone and converts it into estrogen. So both males and females will have this testosterone and estrogen. But in males, testosterone dominates, in females, estrogen dominates. So now what we have to see here is T ratio, testosterone to estrogen ratio is very important. So now all these things, if you summarize, now what are the central causes of low testosterone? One, lack of proper sleep, lack of exercise, sedentary lifestyle, vitamin D deficiency, vitamin B12 deficiency, and some medications. These are some medications like ketoconazole, finasteride. This is a common thing because whenever a patient takes medications for hair loss, the most common ingredient in all these medications is either finasteride or dutasteride. These two will suppress or block testosterone receptors. And there are so many other medications which can suppress testosterone production. So now, what are the common things? Most of the psychiatric medications and medications used for and steroids, generally what we use for skin diseases, and sometimes even acidity medications like domperidone. See, normally there, if you see, for acidity there are two sets of medications. One is like omeprazole or pantoprazole. Second one is domperidone. Most of these medications are available in combination, pantoprazole and domperidone. This domperidone can increase the prolactin level. If prolactin level increases, automatically your testosterone goes down because it suppresses LH. And second thing, stress also increases prolactin, which in turn again suppresses testosterone production. So these are central causes, and local causes is any abnormality in the testis or excessive heat in the testis. See, normally the testicular temperature should be 2 degrees lesser than the body temperature. If testicular temperature increases, automatically the testicular production of testosterone and sperm goes down. So now, prolonged sitting can cause heat in the testis, and people who has excessive fat in the thighs, whenever they walk, because of the friction, the heat generated will again suppress testicular function. So now these are local causes, and previously what we have discussed is central causes. Now whenever a patient comes to us, or whenever a patient is having low testosterone, just giving testosterone injections or testosterone medications is not enough, because you have to find out why testosterone is on the lower side. Then only you can cure the problem. Otherwise, most of these testosterone medications are steroids, whether it is Sustanon or Senose. They should not be taken on long-term basis, because for one time replacement may be enough, but this replacement should be only to bring down your low testosterone to normal range. From there, you have to maintain your lifestyle so that the testosterone production becomes normal. So viewers, I think we have discussed enough about causes of low testosterone. In the next video, we will discuss how to increase testosterone naturally, or how to treat a patient with low testosterone. Okay, keep watching. Bye.